Okay, so when I click on this, it says find plan. So it's open enrollment, right? So we're going to look for the plans. On the left over here is if I had my own account. On the right over here, I'm just going to sign in as a guest, and I'm looking for coverage for 2023. So I'm just going to put my zip code in, and I am going to be looking only for a Medicare Part D at this point in time. Okay. So now it asks me if I'm getting help with any of these other costs: Medicaid, supplemental security income, Medicare savings, extra help. And I'm going to say I don't get any help. So now it wants to know my search preferences. Do you want to see your drug costs when you compare plans? And I'm going to say yes. So now it tells me that I'm ready to enter the name, the dosage, the quantity, and the frequency with which I take these drugs. So I'm just going to make up some drugs. So levothyroxine is a thyroid drug. So I'm going to add the drug. So again, you'll want to look at your prescription, but I'm just going to use the standard amount. So a 50 mcg tablet, 30 a month, 30 is the quantity. I take one every day, and I take for every month. I can change this to every 3 months and for 90 days. So now I have this particular drug that is the levothyroxine, 90 every 3 months. Okay. I'm going to add another drug, and I'll add a torvastatin, which is a cholesterol drug. So I'm going to add that. And the standard that comes up is 40 milligrams. So I'm going to change this. So I could only get a 30-day supply, it looks like. It looks like it doesn't want to give me the option for a 90-day supply. Let me see if it'll let me. Oh, yeah, it did let me type it in. Okay. So every 3 months, I take one a day. So I'm going to add that to my drug list. And then I'm going to add a third one, just because it causes lots of people grief, is albuterol, which is basically a inhaler. So I'm going to add that drug. And I'm going to want 3 every month. So I'm going to add that to my list. Okay. So that's all the drugs that I'm going to take. So I'm going to end here saying done adding drugs. So now I can choose up to 5 pharmacies. Okay. And I live in 80220. And then I can filter these pharmacies by how far they are from my house. So I'll leave that at 1 mile. And so I could add a mail order if I want. I can add Safeway, could add King Soopers, and I can add Walgreens. All of those are very much within walking distance of my house.
I'll call you back.
So now I'm going to finish. I'm going to tell them that I'm done adding pharmacies. Okay. So now it's going to tell me, going to sort this, if you will. So this is just the general information, and it's going to sort it over here by the cheapest drug and premium cost. Okay. So SilverScript, which is an Aetna program, has a star rating of 3.5. This is the plan ID number, which if I decide I want to register for SilverScript, I can put that number in. So the premium is $5.80 a month. What they estimate my yearly cost will be is $757 if I do retail. If I go to the mail order, it will be $754. And my deductible is $505. So that's how they get this estimated total drug cost out of pocket, is that I'm going to have to pay the deductible. And I can look over here at the pharmacies and I can look at the drug costs. But before we go there, let's look at the next one, which is WellCare. So again, they get 3 stars. The premium is a little cheaper, but my out-of-pocket is going to be $943 if I do retail or mail order, and I have to pay the deductible. So you see kind of how you can go through these, and it has them ordered. So let's go back up here to SilverScript, and let's look at the pharmacies. So Walgreens, it tells me, is out of network. So if I buy SilverScript, I'm going to be buying all of my prescriptions out of network. I probably don't want to do that because it's probably going to cost me more money. However, if I go to King Soopers or to Safeway, they're both in network. And if I use their mail order, they're in network. So here's where I start to get the information now about my yearly costs. So my albuterol, if I go to Walgreens, it's going to be $2,200. If I go to King Soopers or Safeway or mail order, it's going to be $640. My atorvastatin, again, is going to cost me $2,000 if I go to Walgreens. King Soopers and Safeway going to cost me $24, mail order $22, and my levothyroxine, again, I'm going to continue to be out of network, and it'll be $24 for each of those. Okay, so then this just tells me what my yearly out-of-pocket costs, and remember we saw the $757 and the $754. This column then tells me when I'm going to meet my deductible. If I go to Walgreens, I'm going to meet my deductible pretty much right away. If I go to King Soopers, I'll meet it in April because I'll have to pretty much pay for the albuterol out of pocket, and or King Soopers and Safeway both. Okay, so this then on a monthly basis tells me what my costs are going to be. So again, these are my estimated out-of-pocket costs for Safeway and King Soopers. By May, I get down to $15. Not sure why it goes back up in July, but it does. And then you see that same increase in October. And probably because one of the drugs fills, if you will, on the 90-day rotation. I can see here then the star ratings as well. I can click here and get more drug coverage. And this is where now it starts to tell me about the prescription or the different tiers that I was talking to you about. So here's where it describes the preferred generics of $2 on a copay, generics 25% and 25 when you're in the coverage gap. This is the donut hole, and then in catastrophic. Okay, so it just outlines all of those different things. Okay, now the next thing I look at, and this is remember when I told you there were some things I wanted you to pay attention to, like the prior authorization, the quantity limits, and the step therapy. So this particular drug company has albuterol as a tier 2 drug. Does not have to be prior authorized, but it does have it on quantity limits. Okay, so 90 is the base, meaning I could get 3 of those, use it 3 times a day. So I may have to get prior authorization if I have to use more than 3 a month. Similarly, the atorvastatin is on quantity limits, but I'm only taking 1 pill a day, so I'm not going to worry about that. The next thing is that this is just a recap, if you will, of the prescriptions that I put in. It does tell me that chemotherapy drugs and Part B drugs are not covered. And we know that because we're working with a Part D plan, not with a Part B plan. Okay. So this is the general way, if you will, to read this printout. And then I can go over here to enroll. If I decide that I want this Silver Script plan, I can enroll. And I'm only going to be able to get so far here because I don't want to actually sign up for this. So you are going to need your Medicare number and the effective dates. You get that information off of your Medicare card. Okay. And it's going to ask you when you became eligible for Part A as well as Part B. It may ask you for some information about other insurance, if you have any. If you don't worry about it. And then it asks when you want it to take effect. So that's the information that you need. So when I hit join plan, then it's going to reconfirm that I'm doing the Silver Script. Here's the plan ID number. And then here's where I put in my Medicare number. And then if I have any other information, and then I check this, you'll want to read through this. And then here's where it's not going to let me go any further because I didn't put in a Medicare number. Okay. So that is the basic information on how we go about, if you will, using this plan finder. So now the next thing that you have to do you see my screen that says making decisions to meet your needs? Suzanne,
Yes.
You have your camera on. If you have it, or Betty, let me know. You do see it?
Yes, thank you.
Okay,
Yeah.
great.
Yes.
Super, thank you guys. So the considerations that you want to think about when you're trying to, again, figure out how you're covered, what coverage you want is what is the cost, which is mostly what we just looked at, the type of insurance that you have. In this instance, what we looked at was the Medicare Part D standalone. We did not go into the Medicare Advantage. That's a little bit more complicated. Your doctor in this instance usually doesn't matter, except if you get into the quantity limits or the step therapy or the prior authorization, because then he needs to know more about your prescription drug plan. And then this is the medicines that you take. So you can enroll on the Plan Finder, as I just showed you, and you can do it all from the comfort of your living room. You can call 1-800-MEDICARE if you decide that you want to do it just with Medicare, or you can call an agent. Doesn't really matter how you do it. All of them will work. So again, this is just a review in terms of if you're enrolling in a plan. So we got as far, if you remember, as the enroll. And then once they asked us for information on join the plan, we really couldn't go any further because we weren't signing anybody up. But this is the information then in terms of the instructions that you will need, your Medicare number, you know, your date of birth and some of those kinds of things. Here is where you also can indicate whether or not you want the payment taken out of your Social Security check or whether you want to send it to them every month. When you click review and submit, make absolutely sure that you keep a copy of the confirmation number. So if there is any problems, we have that confirmation number to know that you did, in fact, enroll during the open enrollment period. And if we have any problems, that we can track back with that. If anyone in this group is low income and you need help paying for your Part B or your Part D, then this is the process that you would use to do that. So Part B is the Medicare Savings Program. There's the Qualified Medicare Beneficiary, or QMB. That pays your A and B premiums, your deductibles, coinsurance, and copays. Works very much like Medicaid. If you make a little bit more money, you might be eligible for the SLIMB or the QI1. Both of those will pay your Part B premium only. If you qualify for either of these, any of these programs, you will automatically also get help then with your Part D premium and your Part D copays. And then you also, in addition to meeting these income requirements up here, you also have to meet the resource requirements. So there's been a lot of talk and discussion about what the Inflation Reduction Act provided, if you will, as part of what Obama signed, or Biden signed last late summer, early fall. In 2023, the big changes are insulin, which we already covered, as well as vaccines, which we already covered. The other big change is that if the pharmaceutical companies increase their prices for drugs over a certain amount, they have to pay a rebate to Medicare. There's a number of other enhancements. One that's being touted a lot is the $2,000 out-of-pocket cost, which, if you remember, as we've been going through this today, the out-of-pocket cost could go as high as $7,400. That won't go into effect until 2025. There's also been a lot of talk in the media, especially on the campaign trails, about Medicare being able to negotiate with pharmaceutical companies directly. That will take effect in 2026 for 10 drugs and in 2027 for 15 drugs. So it's not a lot of drugs that will actually be negotiated by Medicare. So if you would like any type of Medicare counseling, we have some help and support here at the office. You can get help for enrollment, Medicare supplements or Medicare Advantage, or Part D support, and you could get that help in English or in Spanish. We also are partnering with the University of Colorado School of Medicine or School of Pharmacy, and they will help do clinical reviews if you are taking medications that you'd like to know whether or not you're having any drug-drug interactions, whether you'd like to see if it makes any sense for you to take fewer drugs, if you're having some side effects or symptoms, anything like that, they can help with that. If you want to take advantage of that, call Pat here in our office. If you want help and want referrals to any insurance agents, we can help you with that. All of these sessions are available on our YouTube channel, and you can review them again, or you can go to our website and you can get additional information, both about Medicare just generally, as well as other programs. If you want to call our office, our numbers are 303-333-3482. Our toll-free number is 1-855-293-6911. And our Spanish number is 1-855-880-4777. And the next two slides are just a little bit of information about programs and services that we offer here through our office. And we're happy to help you if you need help with any of those. This slide is more things that you can engage in as well, or resources that you can take advantage of. So with that, I'm going to stop sharing my screen, and I will take a look at the chat here and try to answer the questions. So one question says, you may have already told us, but during October 15th through the December 7th period, you can change drug companies to another one and decide which one was the best decision for you. Can you change and enroll again twice in the same time period? And the answer is yes. If you thought you made up your mind, you didn't like what you did, and you want to change the second time, you can change before December 7th, and Medicare is supposed to process the latest or the most recent from their perspective application that you make. Next question, if you enroll for 2023 this way on the Plan Finder, does it automatically disenroll you from the plan you had in 2023 or 2022? And the answer is yes. You do not have to do anything to disenroll from your 2022 plan if you enroll in a 2023 plan. The question is, can I change from a Medicare N to either an F or a G? This is actually a Medicare supplement question, and I'm going to answer this question with a yes, but. So you can change, but if you have pre-existing conditions, usually the new Medicare supplement will not underwrite you. So you can certainly try. You can work with an agent. The agent may be able to work with a new company that has a little easier or less restrictive underwriting conditions. And you can certainly try, but I can't make any promises. Now, I am assuming that you are beyond your initial enrollment period, meaning that you are 65 and 7 months old when I answer this question, or older. If you want to talk with an agent who sometimes is more successful at getting people moved from one supplement to the other, I'd be happy to give you her name. She's an independent, but she works with a couple of different companies, and she's a retired nurse. And sometimes I've seen her change people on a Medicare supplement when I didn't think anyone else was going to do it. And you're certainly welcome to call me, and I'm happy to share that information. Looks like that's all the questions we have in the chat. Does anybody have a question that you would like to ask verbally? You can just take your mic off of mute, and I'll be happy to try to answer it. Okay. Well, thank you all for joining us, and I hope to see you again soon. We are doing some Medicare Monday events in person, and there will be a couple of more Wednesday lunch and learns over the next 3 weeks. So feel free to join us then. In addition to that, I believe I have one more session on the 2023 Medicare changes on Zoom, and I believe that is on November 14th, and I think it's at 1 o'clock. But if you have questions, either check our website at senioranswers.org, or you can call the office and we'll be happy to walk you through that. Thank you, and I will see you all soon.